Hello, good morning, ladies and gentlemen. This is your moderator, and I would like to know if we are ready. I think we are ready to proceed with session one, which is plenary session one, which is a panel discussion. My name is Dr. Michael Katende. I'm from the ES Secretariat Health Department. I hope you can hear me very well, and I will be your moderator for this session, which is a very important session, the first session of the day, which is a plenary discussion. We know that we have used technological solutions to improve healthcare generally, and also during this COVID period where we're responding to the pandemic, technological solutions have been very handy and have been helpful in addressing some or unblocking some of the blockages. Mr. Amit Thakur, who is our keynote speaker, you are very welcome to this session. Amit Thakur is the chairman for African Health Business, and we are very happy and honored to have you as our keynote speaker during this plenary session. You are very welcome to deliver your keynote address, and you have 30 minutes. Karibuni sana.
Yeah, hi, how are you? Let me first thank everyone and confirm that you can hear me clearly.
I can hear you. Everybody is nodding. We can hear you. Please proceed. Please proceed.
Thank you. Thank you to the organizers, and thank you to all the East African communities that have been able to select what I consider a very key subject on e-health within the region. If there is any subsector in the health industry that lends a great promise in improving overall health in the region, it's the whole aspect of embracing digital health. Never before have we ever had the need of digital health like we've had now. Let me just say that the current digital health status, as you can see in this screen, remain under great pressure. As I mentioned, the pandemic galvanized the development of many innovations. We have seen people providing health services. We've seen e-pharmacy. We've seen also remote monitoring of patients using different apps that have really burst open with so many opportunities. The number of African e-health startups have been at an all-time high of 180 operating new companies, representing a huge over 50% growth over the last 3 years. These companies raised a whopping $90 million in the first half of 2020, more than ever before in previous years. Then in the past 5 years, with an increase of 257% from 2019 to 2020. This just shows that the interest and the funding in the digital health space is pretty high. If you look at the East Africa region, Kenya was ranking top in terms of the fertile ground. Rwanda and Tanzania also score pretty well when it comes to the digital health, digital intelligence index. There are a few challenges which I think this particular forum is best placed to address, and I'm sure many of these will be discussed by my fellow panelists and the other sessions on the two-day symposium. If you look on the left, if we got those 8 things right, the amount of health that would reach the people of East Africa and the people beyond would be immensely amplified. We do need to work on those indicators, and there are some sub-indicators you can look at. But what's coming out clearly is that the leadership and governance has changed dramatically. The pandemic has also shown that the level of partnerships and the level of trust between public and private, between public and development partners, and between development partners and private sector is cementing to become much stronger. I believe that that is a wonderful movement, and it's going to change what we will see as the health of the future for Africa. The strategy and investments are very critical. We are being able to attract new investments. Maybe manufacturing is another area that the governments and the ministries are trying to ensure that we get more revenue coming in, health services. But digital health certainly is now the star subsector for many investors across Europe, across US and developed world, and also within Africa, to expand within Africa. There is one point that I would like to highlight to all the leaders that are on this call and the ministry champions. It's about the environment and the legislation. Once we have the right framework and we have the right laws, I think you will see into the health space within East Africa. So I encourage the Ministry of Health, the ICT leaders, and the departmental heads to give focus on the right legal frameworks and the policies, such as giving licenses for telemedicine providers, licenses for e-pharmacy, licenses for data analytics companies, and having a very open discussion on the whole open source and proprietary models of utilization these kind of solutions in the health sector. I know the open source sounds like it's a silver bullet to solve all problems and costs around the challenges we have in buying systems, but it is not the silver bullet. I think the good balance between open source and proprietary is the right formula for better health. And I'm sure that debate will be coming in this forum. So coming to the workforce, I believe that the new cadre of digital health experts and healthcare workers, we may find that the whole digital health training will be embedded in the nursing course, in the doctor's course, and the farm tech and the pharmacist course. This will be part and parcel of the curriculum. I also think we'll be giving training on artificial intelligence. AI health engineers will be a new course that I hope will create again a momentum towards improving digital health. Standards and interoperability, I think that's very clear, because we do want to protect the interests of the public on ensuring that you have particular standards before licenses are provided and before institutions are given a go-ahead to reach out to the population of 300 billion within our region to receive health services through digital health companies. We know infrastructure is important in terms of how much mobile phone penetration, the broadband penetration. We are proud that an organization like Econet, for example, is laying down amazing amount of cables up to 100,000 kilometers. We are also very happy that companies like Safaricom are moving into countries like Ethiopia within the neighborhood. These are all fundamental infrastructure necessities that we can build healthcare upon. So if we make solutions that are user-friendly, it will also enable us propel the agenda. And of course, one of the barriers that we need to deal with clearly, and this team and the audience in this particular conference can do very well, is governance and policy. So need for competencies and high integrity leadership. Suboptimal regulation, we need to remove that suboptimal regulation. And we need to also remove the fragmentation of players that currently exist. How many times do you get a vendor and so many vendors offering the same thing in a different manner? And this fragmented approach causes more confusion and provides potential ground for increasing costs. I would like to end here, take this opportunity to thank the moderator, the organizers, and also all the attendees who've come and and witnessing this session to say that East Africa is in a brilliant place, in a super place to promote the digital health. And I personally believe that we will see a huge number of new companies and old companies expanding in this space. And I want to encourage the regulators, the ministries of health, and the champions to be committed in opening up and creating an enabling environment for us to take health closer to the people that is affordable, of the right quality. Thank you, Mr. Moderator, and over to you.
Thank you very much, Mr. Amit, for that wonderful keynote address. You have touched the key issues that we believe this session should address even further as we go into listening to other speakers. Allow me to bring in the next speaker, and we are bringing in Engineer Daniel Morenzi, who is the Principal Information Technology Officer at the East African Community Secretariat. He's going to talk to us about using ICT during this COVID-19 pandemic, looking at the illustrating both the limitations and opportunities from the regional perspective.
Yeah, thank you so much, moderator. Allow me to take this opportunity to thank the Science and Technology Commission to have organized this important session for us to deliberate on the using technology in our health sector systems and also during this COVID pandemic. I will briefly touch on I will focus on the use of ICTs in different actors. Key areas at the individual level, organization levels like ESC, our governments, and the private sector. This COVID-19 has really caught us unaware, if I may say. Part of it that what the ICT really impacted on during this COVID pandemic was that the policies that our moderator has mentioned about that were caught us unaware. You know, East African community, it's only 2 countries that are not landlocked. So imagine if the technology had not been embraced. Thank you to the whole Ministry of Health representative here for embracing the electronic cargo tracking system. And now we helped the movement of goods and services. And that is one of the major benefits of now working together. As our moderator said, do we set our standards? Yes, the region has moved further to now champion this, to make sure that at least during such a pandemic, we are able to now have a harmonized systems for information sharing. So harmonization and using of the ICT has really impacted our economy, that we did not fall totally down, and the movement of goods continued, whereby now the e-payment was embraced. So the region, as we are tackling onto the use of ICT, especially during this COVID pandemic, we basically focused onto the 4 pillars I mentioned. At the individual level, how does an individual be served? How does the organization such as ESC continue to perform its mandate of regional integration agenda by looking together of the how movement of goods, services, integration on health matters, education continue, how the governments can now communicate, and also how the private sector is enabled to continue the business. But this was triggered by the COVID. So the question now we pose to ourselves, if we had not got this pandemic, would the region have ever, or would the world have ever thought of having a coordinated mechanism of now embracing technology, use of the ICT in delivering our services? The misinformation that has been going around the COVID has now made the region to now invest more onto the harmonized systems for the information sharing. ESC has embraced technology by implementing the EAPS, the East African Payment Systems. You know very well now that our region can now exchange the resource money instead of going the SWIFT via the the normal SWIFT you are aware of, there is now the East African payment system that where national banks communicate to each other. And it was now embraced during the COVID, that now it was now done more faster. So this is now embracing the using of the technology during this pandemic, but the cost. There has been too much cost incurred. I'm not supporting the COVID, but it also triggered the enabling and made us to rethink that now this pandemic has come. We need also to plan for another pandemic that might come, because there is always that information shared. Our moderator and the participants are largely global, the Global Networks Society. The social structure and organizational arrangements are largely made up of the information network that is powered by information and communication technology. So when you look at the global arena now, we are all dependent on the information sharing. So embracing the use of the technology at the regional level has made our region now to be, I think, the first to be now coming out of the semi-lockdown. You are aware of what is now being implemented, yet to fully be rolled out. And I thank our guest of honor during the opening remarks, where she clearly mentioned about embracing the homemade solutions. Today, at the regional level and at our partner states, the kind systems that we are using for monitoring the COVID are homemade solutions. And the regional system that we are now using for sharing of information is a regional made system. It's owned by us as the region. So we couldn't wait now to depend on as the keynote speaker mentioned, embracing the foreign investment from the other regions. So we have now looked back at the regional level that we now do our homemade solutions. The open source that has been mentioned, allow me to talk about that. The region is positioned in itself to make sure that the use of the technology is now at the optimum usage, at the maximum utilization. You have seen in our finance ministries, we have now the FMEs that is homemade. It's the regional embraced, and it is used by our ministries. So I want to mention that the coming of the COVID had both limitations, but also the opportunities in now using the technology, because we found that where we are in the lockdowns, we couldn't even have now had such a scenario of holding such a conference without embracing the technology. So the more limitations that we are facing, and we request that this meeting can take also, this conference can take a good resolution, is now how do we regionally collaborate to calm down the cost of the investment on the technology. The COVID pandemic has really illustrated a lot and has exposed our major challenges in our education sector, health sector, financial sector, and the private sector. But basically in the health sector is the one that was totally caught unaware due to have a lot of fragmented systems that we have implemented. Now, as I want also to follow what the moderator did by maximizing the time, I would conclude my talk on this issue of the illustrating technology during this COVID pandemic, which is an opportunity and both a challenge, that at the regional level, once we embrace technology, especially in the health care services, we will have saved a lot of lives. Today, you will be able to know that how many gas cylinders that are available in my country by just a click of a button, and you are saving lives. What is the rate of the contamination within my districts or counties, and you are now knowing the measures to put because you are clicking a button. And another thing is that the cost of investment to this looks to be high, but is the most achievable one, because you are now cutting the cost of the travels, elimination of the quality data that is not quality well audited, And another major opportunity is that we are able to give the service to our citizens globally and who are traveling, and we are encouraging more of our tourism sector to come back. So, honorable ministers present here and the permanent secretaries and other distinguished guests, we request for a regional and a national support to embrace the regional work together and the systems integration to eliminate the barriers of information sharing, quality data that we don't have as a real-time data, that one country has done better and another one has not. And now we are facing a challenge of another coming lockdown, because if we had embraced technology, some countries would not be now talking that there are fake certificates coming from one country to another. And as we are now going to digital ESC platforms, we request for the embracement and make sure that we are now solving the challenges. The solutions are with us, the region, as our keynote speaker said, and we don't need to now wait for someone from Europe, America, Asia, Latin America, because those are our colleagues that we studied together with. It's just a matter of the climate change that makes me and him a different person. I now submit my moderator, and I hope I have used good time so that we can hear from others. But we request everybody to embrace technology. Thank you.
Thank you very much, Engineer Daniel Morenzi from the ES Secretariat, Principal Information Technology Officer. We are grateful that you have made this submission. Many points in there. We have some questions. What lessons has COVID-19 provided us to improve health industrialization in terms of medical supplies, reagents, as well as medicines for patient management? I think there's local production there. The other question is, should we embrace or adopt homemade digital solutions or the digital public goods stock solutions?
Yeah, thank you, moderator. Regarding the homemade solutions, we have learned a good lesson from the COVID-19, whereby our national systems are the one doing the best work now done. I would give several examples: the Kitenge system of Kenya, the RDS of the CPHL, all that of Rwanda and Burundi and the rest. So the homemade solutions have proven to be the one that can give us the real-time information, because they are really focusing onto the challenges we are facing as the region or as a country. But now bringing a customized system from any other country that doesn't capture the one, it is a challenge. Second, on the issues of the information sharing and the rest, we have systems that are many, as our guest of honor said, in the countries. But now what we have embarked on is, first of all, at the policy level, we set standards. At what interoperability layers are we using? We are using FIRE standards in health system. So when we are at the FIRE standards, what can we do together? It's now coming together, set regional systems, regional standards, because a country like Kenya, Uganda, Tanzania, Rwanda, they all share common things as having in the common region. So I recommend that when we come up with our regional standards that can be customized at the national standards, we will be able to achieve in the health sector, because we have already achieved it in other sectors like customs and trade.
I will now invite Dr. Novat Twingubumwe, who is the acting executive secretary for the East African Health Research Commission that is based in Bujumbura, Republic of Burundi. Novat, you are very welcome to make your submission. Please stick the 15 minutes. Thank you very much.
My name is, as he said, moderator is Novat from East African Research Commission. I would like to, just as introductory words, I would like to wish to say that digital health is an emerging field of study at the intersection of healthcare and digital technology, which has attracted lots of attention in the past decade in many countries around the world. The digital health has a broad scope of technologies as digital health We can mention mobile health, wearable devices, telehealth, telemedicine, health information technologies, and personalized medicine. The World Health Organization emphasizes that digital health can be beneficial to achieving the Sustainable Development Goals by making health and well-being services accessible with high standards for all people globally. We know that digital technology is expanding rapidly in Africa, and we have all witnessed its ability to revolutionize communications and financial transactions in East Africa. And it is now time we harnessed this potential to do the same for health. The East African community has the opportunity to use digital technologies to transform the health sector by strengthening all aspects of the health system and expediting the achievements of UN Sustainable Development Goals for a healthy and prosperous East Africa. After these global introductory words, I would like to just to say that telemedicine, as one of the points I'm going to share as a global information, telemedicine is the field of delivering healthcare services remotely to the patients by leveraging information and communication technology like telephone, mobile, video calls, emails, chatbots, and the e-portal. The latest advances in information technologies have fostered more innovative telemedicine systems that provide high-quality medical screening and diagnostics to patients anytime, anywhere. So these new developments have drawn significant attention, especially in underserved communities, as well as during crises and emergencies. And however, in order to successfully implement these technologies and provide adequate care, various challenges need to be tackled. This is especially about the maintenance of the privacy, the patient's privacy. We are observing that we are using this new development of technologies, but we have to think of, when we are initiating using these technologies, to think of the privacy of data and of the patients. Actually, there are numerous technological platforms, including open source platforms, that provide telemedicine services to healthcare providers and the patients. So the idea of telemedicine has existed at least as long back as the 17th century, with the aim of how to give medical services to the remote patients. For example, at the time, Greeks used to send their urine samples to the distant physician for diagnostic and get a prescription back by post. This was just a first way of using telemedicine. So there are several scenarios in which telemedicine services can be very beneficial and in some cases essential. To begin with, in the case of emergency situations in remote locations that are struck by calamities like floods, earthquakes, and where transport are inaccessible, telemedicine can play a crucial role in providing necessary guidance to local doctors. Perhaps the most significant beneficiaries of telemedicine are the people of developing countries that lack proper health structures and medical experts, especially in specialized medical fields. This is largely due to the fact that a majority of people in developing countries live in rural areas. However, in recent areas, we are observing that there is a considerable penetration of mobile and internet in rural areas of developing countries. Distinguished participants, I would like to recall you that the World Health Organization has actually a global strategy on digital health 2020-2025. And the purpose of this global strategy on digital health is to strengthen health systems through the application of digital health technologies for consumers, health professionals, healthcare providers, and industry towards empowering patients and achieving the vision of health for all. So the strategy is designed to be fit for purpose and for use by all member states. So e-health, also called e-health care, is use of digital technologies and telecommunications, such as computers, internet, and mobile devices, to facilitate health improvement and healthcare services. So we know that costs of healthcare services are rising, and healthcare professionals are becoming scarce and hard to find. It is imminent that healthcare organizations consider adopting health information technologies just to address that issue. Actually, distinguished guest participants, the East African Research Commission has conducted a review of digital health programs in the EAC partner states to contextualize the roadmap and to identify existing assets that can be leveraged across the region. Many services and applications in different partner states are present, and the countries are using common technologies such as DHIS2 platform and the Open Health Information Exchange components. The use of common technologies combined with the fact that countries face similar challenges like the lack of digital health expertise, limited infrastructure, unreliable connectivity, and the fragmented e-health initiative. This indicates a strong opportunity to share experiences and assets, and opportunities also exist to use common global goods across partner states and to leverage existing regional surveillance initiative. When we did our assessment, we observed that partner states are at a different stage for any common goods we are assessing. So here we have assessed in each country, in each partner states, 3 common goods, namely a facility registry to allow partner states, the EAC, and other implementing partners to manage and share common health facility identifiers. So these 3 common goods are a facility registry, a terminology services, and a regional data warehouse. So here we have observed that all partner states are different stages, meaning that there is a need to mitigate these gaps that are between and within the EAC partner states. Mr. Moderator, distinguished guests, this is what I wanted to share as general information and the small milestone we have already achieved regarding the digital region initiative. I submit, Chair, and I thank you for your attention.
Thank you very much, Dr. Novat. Our next presenter will be Miss Brooke Partridge, who is the CEO Vital Wave, and she's going to present or talk to us about the digital agenda as an enabler for the rapid development and scaling of new regional-wide and digital-enabled services. You are very welcome, Brooke. Karibuni sana.
Excellent, thank you. So thank you so much for the introduction. Again, my name is Brooke Partridge, and I'm the CEO of Vital Wave. We are a professional services firm that specializes in digital for development, and we are very proud of our partnership with the EAC, historically in the creation of the Digital Reach initiative that Dr. Novat just spoke about, and now with with Isteco in the development of the EAC regional digital agenda. And I'm here to talk to you today about what the digital agenda looks like as a mechanism for providing region-wide digital-enabled services, and specifically how that can transform health systems within the EAC. So broadly speaking, the EAC digital agenda is meant to transition the EAC into a digital economy through a secure and seamless regional digital infrastructure that provides various e-services to a range of sectors, including energy, climate change, education, trade, and health. And the reason that a single digital agenda can address the needs of so many sectors is because the infrastructure required to support those services is essentially the same. Whether you're tracking climate change or you're doing cross-border disease surveillance, the type of technical infrastructure that's required is very similar. So today I will speak specifically and in depth about the health sector and how it is transformed when the health sector regionally and at the country level achieves digital enablement. So I'd like to start by talking not about digital health and not about the digital agenda, but about health service delivery, because that is the key to reduction in morbidity and mortality. So when we talk about the health service delivery value chain, we start with patients that are educated and informed and seek care when they need it. And when they do seek care, they find facilities that are staffed with qualified care providers, and those facilities are managed with equipment and commodities, and there is relevant data available to help guide the service that's provided. And throughout the course of the interaction with patients, data is actually collected and then shared back into the system. It's the provision of this type of service on a comprehensive basis across the whole region that will have significant impact on reducing morbidity and mortality in the region. The way to achieve that scale on a sustainable way, on a sustainable level, is to provide certain capabilities through digital enablement across the whole region and across individual countries. When that's achieved, something else happens as well, which is an entirely new level of data collection and availability. And that data becomes available for public health activities as well. So not only do we have an important impact on the delivery of health services on the ground, but also an important transformation in public health activities through the availability of real-time data. If we think about the current practices of surveillance, of health surveillance, a lot of that is managed through the extrapolation of survey data. So there's a lag in timing, and there's a margin of error in the way that data is developed. When we see digital enablement across an entire health system, we actually get a level of real-time data that replaces the need for extrapolation of data and development of data in other ways. It completely changes the way that surveillance can happen in a real-time way. So this vision for a country or a regional level of health service provision is something that the digital health community has been working on for close to 15 years now, but it's been a struggle to achieve it. The reason is because of very siloed, fragmented implementations of the different types of digital functionality that you see here on the slide. And And so the digital health community has very much taken a step back and said, how do we address this? How do we overcome these issues? And the answer is very similar to the approach of the EAC Regional Digital Agenda, and that is through the creation of shared digital platforms. As I mentioned earlier, every sector, including health, requires a similar solution stack for successful scaled provision of technology, starting with the basic infrastructure and the central systems that need to be provided, like ID management and data repository management. And all of these capabilities can support a very wide range of applications. For those of you familiar with the term, this is often referred to as enterprise architecture or an enterprise architecture approach, where one single platform can provide support to a wide variety of applications. You can also just think of it as a shared digital. This is not a new concept. It's one that's being embraced very broadly across the EAC, across individual countries and other regions, and by donors and multilateral organizations, all of whom in their published strategies for digital health or digital development generally are promoting the use of enterprise architecture at the country and region levels for more cost-effective, predictable scale of the provision of digital services. And it's important to it's helpful to know that that this is an approach that the entire digital health community and the digital development community is embracing at this point. So what happens when multiple countries and regions begin to achieve digital enablement on a broad basis? Then you have a wide range of geographies that are producing entirely new levels of data that can be used by the global and regional health agencies to conduct research, to do disease detection, emergency response, and importantly, that data remains in the geography. It remains owned by the geography, but the dimensions of information that are needed to do analytics and to provide new insights at the regional and global level are taken in and then sent back to the country and the region level. So we have a future state in which both public health and health service delivery are transformed across multiple geographies. So if we come back to the EAC Regional Digital Agenda more broadly, the kind of transformation that we've discussed today in health is also possible in all the priority sectors of the digital agenda that you see highlighted here on the slide. And it's absolutely feasible for the region to provide a platform that supports health, as in the examples that we just looked at, as well as these other priority sectors. And that is the power of having a regional digital agenda to reach economies of scale, to achieve scale itself across the region in a sustainable and cost-effective way. And it represents the potential of both economic and social transformation across the EAC through fundamental digital infrastructure development. Thank you.
Thank you very much, Patrice, for that submission. And our next presenter is going to be Mr. Giulio Malicane. He's going to talk about big data and health information systems. And Giulio is from the digital transformation at UNCDF in Uganda. You are very welcome, Giulio.
Thank you, moderator, and Asante. Thank you, moderator, and good morning, everyone. My name is Giulio Malicane. I'm from the UN Capital Development Fund in Uganda. and allow me to present our approach to health information systems and big data in the digitization of the healthcare sector. It's clear that the healthcare industry is facing a big shift beyond focusing on how to improve the quality of health using traditional means. So digitization is now playing a huge role in the achievement of better quality health. The sector is collecting more data than ever before, as technology that we use to collect and manage data is getting more advanced and complex. So to do the policy issue around responsible management of data. It's our responsibility as stakeholders to emphasize on the usage of technology and data for better planning and decision making within our ecosystem, but also to leverage partnership between stakeholders to achieve better social impact. So at UNCDF, we have a program called Leaving No One Behind in the Digital Era, and that program focuses on building an inclusive digital economy using digital solutions in key sectors, including the healthcare sector. So allow me to just share our approach to both health information system and big data, but also other emerging technologies such as artificial intelligence and what came out as the findings was really not new to us or to the ecosystem, but it was confirmation of what we already know. From there, we actually engaged with different stakeholders. We did a stakeholder mapping.
Julio, we can't hear you. Are you still there?
An organization called BRAC and MEDIC in partnership with the Ministry of Health. We are digitizing a VHT model, which is the community health in Uganda. Still have an echo. Someone has activated the mic. Please try to deactivate the mic. Thank you. Yeah, so one of our projects is the digitization of VHTs, the government model. So BRAC has been leading the digitization of VHT or community health workers within the region. However, they've been working. So what we try to replicate what they're doing by trying to replicate the model to create a government. So these pilot projects supports the government of Uganda to digitize already existing community health workers toolkit and protocol supporting the national COVID response in West Nile and Northern Uganda. So the aim is to improve the quality of service of community health workforce, including community health promoters, which are called VHTs, CHUs, supervisors, biostatistician, and the district health team. So the objective of this project is really to ensure that we're empowering community health workers to collect real-time data on the key Ministry of Health indicators in alignment to use cases jointly selected with the government. The second one is to improve the delivery of community-based health services such as antenatal care, postnatal care, immunization, reproductive. Is to improve the motivation and performance of these since these are kids. So the consortium for these implement, we have BRAC who is leading the leading partner, and MEDIC who is the technical service provider. So the responsibility between them is actually split in a way that BRAC they actually engage with the health in the technical working group. and the overall project monitoring and documentation, when Medic Mobile is leading the technical service design, development of the tools and workflows. So the work of Medic is also responsible for documentation of data use cases and models, develop modes, analytics, and software modules, such as visualization for analytics. So our pilot project focusing on 4 districts. We are talking about Koboko, Maracha, Nebi, and Lira. And these criteria came from the quarterly report from the VHT and ICCM, and also came from the UNCDF priority district, so that the team can leverage resources on existing engagements. We have also providing support to the Ministry of Health with strengthening district capacity to use evidence-based planning. So let's talk about the software. So the software is, it's called the CHT, which is currently supporting 26,000 health workers, serving an estimation of 13 million of people across Africa and in some countries within the Asia. The core framework supports multiple languages, runs offline when needed, and sync data when connectivity is available. It runs on basic phones, smartphones, tablets, and computers. And you can see clearly that it creates a linkage between community health workers, nurses and health facility staff, and managers at the hospital level. So again, this tool is a free and open source toolkit to advance universal health coverage through shared partnership, shared technologies and resources. So this toolkit has been developed by Medic Mobile in consortium with other organizations. So again, this is a simple UI UX. So through different human-centered design, Medic Mobile has been able to develop a solution that is easy to use, as we all know that our VHTs have low literacy rates. So they designed this in mind, making sure that this can be used by people with very Medical Access Uganda and Signalytic, and this is really to leverage the use of digital solution to improve the supply chain of drugs and medical supply within the health sector. So we know that one of the biggest issues at the health facilities in Africa is the frequent stock out or drug expiration at the health facility level. So what we're trying to do here, we are trying to focus on the lowest of the pyramid. Doing this, if we can prove that this reporting can work at that level, it can definitely work at any other level. So of health sector staff in planning and support. So for this specific project, we are actually leveraging some of the innovative digital infrastructure. We know that in rural areas, one of the biggest issues is the coverage, internet availability. So we are using a micro server that create a standalone kind of a network that can be used with very limited connectivity. So, and if we are able to prove this model, then this will be very useful to the different use cases in East Africa. So this is also interoperable with DHIS2, RX solution, and other solution within the ecosystem. And from the users and consumers. So talking about big data. So our approach to health information system, so I've shared with you our two projects with emerging technologies such as big data, artificial intelligence, and machine learning. We see that we have the responsibility as stakeholders to emphasize on the use of data for better planning and decision-making within the ecosystem, but also leverage partnership between policymakers, innovators, developers, development agencies, and academia for a better outcomes through dialogue. So we need really, UNCDF has a mandate to, has a special mandate as a market facilitator and bring to and tend to bring stakeholders together through dialogue to really discuss some of these use cases and really facilitate and improve the capacity of innovators to bring up some of these services as well as model in different markets. UNCDF, again, as a market facilitator, has been working with different startups, such as Startup Uganda. Maybe my colleague Richard will elaborate more on this, to really understand that ecosystem, but also try to improve the capacity of those innovators for them to bring some of these digital services. And this will definitely disrupt the market with the right support. So talking about big data, we think about what Uber has done in the transport industry. We think about what Airbnb has done to the hospitality industry. Us as stakeholders, what can we do to disrupt the market? What can we do to really make sure that we are serving everyone? We are serving the people within the urban area, within the rural areas, but also making sure that we are preventing some of the diseases before treating them. So if we are able to prevent most of these cases, we'll actually be solving a bigger part of this issue. And this can really bring some of the use cases around medical insurance, making sure that these are affordable not only for the urban consumers, but also for the rural consumers. So on the other side, we are living the pandemic, the COVID-19 pandemic. We know for sure that big data can play a big role into disease surveillance, and by tracking and monitoring some cases and predict outbreaks. And this can be a game change into the current reality we are living in.
Well, thank you very much, Julio, for that in-depth presentation. Indeed, big data is important. Data is important for informing policy, but also improving programming, and we need to use it. What comes out clearly is the need for partnerships, both public and private. Ladies and gentlemen, we are running late. Allow me to quickly bring on board your questions in the chat room. I'll bring them out during the discussions. Allow me to quickly bring our the second last presenter, who is Mr. Richard Ndahiro, who is is going to present on e-health applications, applications response to COVID-19 with the drone. Richard Ndahiro, you are very welcome.
Thanks, moderator, and I'll endeavor to use less indeed. My name is Richard Ndahiro. I also work for the UN Capital Development Fund. I hope you can see my screen. Kindly confirm, moderator. Perfect. So quickly, I'd like to share an initiative we are undertaking in Uganda in partnership with the Infectious Diseases Institute. And it's an initiative around how we might bring drone technology to improve delivery of health services around the response to COVID-19. Just quickly about the approach that we take at UNCDF, not being experts in the health sector, but around how to bring digital to the sector, is we start with what can digital actually do, and that for the last mile, at scale in a very sustainable way, and bring about systemic change. So the initiative is to work with IDI, which is already very entrenched in infectious diseases in Uganda and very close to the Ministry of Health, to be able to see what can digital really bring sustainably for the last mile in the health sector. But we also do that in education, agriculture, and finance. When you look at the challenge of infectious diseases, and specifically COVID-19, there is a very strong health logistics challenge there around when there's an outbreak. How do you quickly intervene with surveillance, early warnings before even the outbreak shows, and rapid response? And this we've seen loud and clear with COVID. The capacity to be able to detect early in a given region and put it in quarantine can mean a lot in terms of curbing down the infections. Next, though, is medical supplies and how you deal with those in a very timely manner, but also laboratory capacity. And as I talk about this, think indeed about the last mile. So this is an example of what we're doing in West Nile, Uganda. I don't know that the visual is very visible, but look at the blue lines that's the flow of samples from smaller health centers to the large health centers. And in the entire West Nile and northern Uganda, you have around 3 key collection points for testing COVID-19 samples. And in terms of the current turnaround time between a given health center and the collection hub, you have some districts that are at 72 hours, 24 hours, and 48 hours, with the current means, which is motorcycles and vehicles. So there is a very strong challenge of rapid response, rapid testing, not even talking about surveillance. And this brings a case for medical drones, and that's how we got in partnership with the Infectious Diseases Institute to say there is actually a good case for medical drones here, and let's try it out and see what the outcomes would be. And the intent was drone deliveries and pickups between hubs and health facilities, increasing access to PCR testing at the last mile, and surveillance of outbreaks in the long term, but also couple that with a medical information system that allows for people to be managed remotely. So an IVR or interactive virtual reality service so if you're able to register or if you're tested and you're positive, how do we follow you up remotely? And the IVR service comes in handy. This project is a learning project, and I know we've talked about the lots of pilot projects that keep happening, but it's a learning project that is trying to ascertain the technical feasibility of using drone technology in such a geography. I'd like to mention that there is already another pilot that is happening in a different region, and the objective is to look at 2 quite diverse regions, pilot with these regions, and whatever we learn from those, IDI and the Ministry of Health are able to actually see the ways to scale to other regions that would be in the middle of those 2 extremes. So feasibility, technically, acceptability by the population. There are actually a couple of question marks there on how does the population perceive health services delivered through such technology, but also being able to ascertain what the impact is in terms of turnaround times and the impact on medical stockouts. And lastly, but even most importantly, is what do drones look like in terms of cost? Yes, we might have a good technology, but with very prohibitive costs of implementation. So the project aims to indeed contribute to learning around these 4 key areas, and that would be shareable across partners and even the region. The expected outcomes from this project is, I told you about the 72, 24-hour turnaround time, but the expectation is that with this project, we'll be able to reduce the turnaround time from 72 to 24 to 8 hours with cost neutrality. We hope to be able to achieve this and be able to share how we were able to reach that level of turnaround time and neutrality. The next one, which is in terms of how the systemic change that I was talking of, how do you link such an initiative to existing initiatives around community health extension workers, VHTs, who are at the last mile and not really very well linked to the healthcare system? So by using such technology to deliver first-hand emergency support to these frontline workers is another outcome we are looking to. And also talked about it, the impact on stock replenishment of essential goods and medical supplies across the healthcare network. That said, we are very aware, and maybe this is also something for this forum to continue to deliberate upon. Yes, we are actually testing and finding ways to use drone technologies in the health sector and other areas, but a couple of broad questions persist that are worth debate and improving upon. The issue of the policy environment and the ecosystem for drones. Drones today, I mean, if you go to any wedding, there'll be a drone taking pictures, but that's for that type of use case. When it comes to other use cases like the use in health, the use at scale, what would be the right policy environment? And there is a lot of work to do there. There is a lot of work around the economics of drone delivery, because at the end of the day, like I said, if it's prohibitive to use drones, then they might never be fully ubiquitous in the health system. So how do we make the economics work? And that would also come with finding the right sustainable business models that would work for the health sector. For example, today, a lot of the drone types of use cases are led by private sector initiatives. Whereas we know that healthcare is social services driven. Of course, there is private healthcare, but driven by public sector. So how do we blend that, the fact that the technology is driven by private sector, and how do we bring it into a public sector-led delivery sector? What business models would work there? It's been said before, and that from the keynote speech, the issue of pilots. And the issue here is how do we move from pilots indeed to scaling up? But as I look at this lineup of broad questions that persist, for me, I actually think these are questions showing progress in this space. When you start thinking of scaling, it means you have good signs in pilots. When you start thinking of making the economics right, it means that there is light somewhere at the end of the tunnel. So the issue of scaling, the issue of sustainability, the issue of economics are outstanding questions that need to continue to be debated. And lastly, the issue of information sharing. Various pilots happening across countries. Rwanda is a bit advanced. Ghana has already kicked off COVID response through drone technologies. Uganda is undertaking the same. How do we share information and learn? Because for us to be able to move the needle, it's through cross-pollination and these learnings that we are able to, I think, move quicker and be able to achieve the scale that we need and the sustainability with the use of drone technology. And just to end my submission, moderator, I would say that accelerated learning and sharing across the region and continent will lead us to getting health drones to be ubiquitous in the health sector. Thank you.
Allow me to go quickly to switch gears and bring on board our last presenter, who is Mr. Sam Wambugu. Is a project director at PATH, and he is going to talk to us about the East African Community Digital Health and Interoperability Assessment.
Yeah, thank you, everyone. I hope you can see my presentation. I'll be speaking about a study that we conducted 2 years ago, almost 2 years ago. That is the East African Digital Health and Interoperability Assessment that was funded by USAID in collaboration with the ISTECO. Now, I'll go straight to why the assessment was necessary. Well, one of the questions we had to answer at the time was that the East African community considers health challenges a threat to regional integration and development. And technology was considered key in healthcare delivery, both nationally and within the East African region. However, there were certain barriers. One was that the regional information systems needed to be interoperable to be able to share data among the member states. Policies and regulatory frameworks needed to be harmonized, and also healthcare infrastructure for e-health needed to be established and enhanced, as well as they needed to have a unique patient identifiers to be in place so that when patients move from one country to the other, then they can continue with their care.
We don't see any slides. I hope. Yeah.
Oh, thank you for letting me know.
We can see them. Thank you.
Okay, you can see them. Okay. All right. Thanks. So, what was the scope of the assessment? The assessment covered Kenya, Uganda, Rwanda, and the United Republic of Tanzania. That is, Tanzania mainland and Zanzibar. And you can see the stakeholders there. The East African Community Secretariat, Ministries of Health of those countries, ICT entities, and a large number of stakeholders who contribute to health within the region. And the assessment was between March and September of 2019. Quickly, I'll go to the methods that we used. We used three-pronged methods. One, we had an assessment oversight team in each of the countries that was meant to inform the assessment, and that was a small team in each of the countries. We also conducted a desk review to be able to appreciate the information that was already documented in documents and had been collected by studies before ours. And also, we reviewed global tools that, together with the rest of the stakeholders, including Moses and the ISTECO, agreed that those were the right tools to use to collect the digital health and interoperability data. Now, one of the key things that I would like you to take note before we go to the deep into the assessment was because we are looking at interoperability of health information systems within the region, we needed to define what interoperability is, and we defined it using one of the tools that one of the maturity tools that had already been developed and identified interoperability in three main domains. One is that interoperability contains technology, it contains human resources, and contained leadership and governance. And each of these three areas, we unpacked it. For example, for technology, we had data management, operations and maintenance of information systems, the hardware, the national enterprise architecture, the standards for communication and data management, HIS systems, and communication networks. For human resources, we looked at three areas: the policy for digital health that govern human resources. We looked at the plan for capacity development, as well as the availability of required digital health skills and numbers. The area of leadership and governance was broad. It had 8 areas: data ethics, compliance with data exchange standards, business continuity, financial resource mobilization, financial management, interoperability monitoring and evaluation, governance, structure for HIS, and documents for guiding interoperability. Now we'll see now how these play out in the assessment. Now we also used another tool, which is the Global Digital Health Index. So this tool also helped in collecting additional data besides what we could have collected using the HIS interoperability maturity model tool. Now the Global Digital Health Index tool looks at 19 core indicators for measuring progress in digital health across 7 categories established by WHO International Telecommunication Union e-health strategy framework. So with these tools, we were able to collect data and map it within a 5-point scale for each of the countries. Now, this is the maturity continuum that we worked with, that if we assessed any of the 3 domains, we could map the results from nascent through emerging, established, institutionalized, and all the way to optimized. So meaning that the lowest level, or the lowest score was nascent, meaning that the country did not have basic HIS capacity, and optimized, meaning that the government in that country and the stakeholders were routinely reviewing that element and adapting accordingly, meaning that that element was resilient. Let me share some data to try and characterize that. Let's talk about leadership and governance for HIS and interoperability in Kenya. You can look on this graph, you can see on this domain of leadership and governance, you can see these 8 elements presented by this graph. And which was the strongest? It was that the country had interoperability guiding documents. The guiding documents were there. That's why on the 5-point scale, it is called at 4. In terms of the governance structure for HIS, meaning that the structures for discussing and steering forward issues to do with the interoperability of the information systems in the country was at established, which is 0.3. However, you can see the rest were between nascent and established, that's between 1 point and 2 points. How did it this look in Rwanda? You can see the data for Rwanda, quite a number of strong areas in leadership and governance, including the last point, which is a governance structure for HIS, scored all the way at 5, which is the highest an element could score, as well as business continuity, meaning that if systems were to go down, there was mechanism in place to come back live and continue to support services, same as financial management. But there were also a few elements, as you can see, that needed to be strengthened. Looking at Uganda, financial management scored strongly at 5, and at 3, which is established, meaning that the government was taking a leadership role on that element. That was on governance structure for HIS. Many other areas were identified, and there was consensus that they needed much further strengthening. We now look at Tanzania, still the same elements of leadership and governance, and you can see 3 areas scoring strongly in terms of interoperability documents available in the country, mechanism for compliance with data exchange standards, as well as financial management, scoring all the way to 5. However, a majority of the other areas were emerging, meaning that something was just starting to form. That's why they scored at number 2. Zanzibar, there was consensus within Zanzibar, stakeholders, as well as the data that we collected to show that the country on all these elements of leadership and governance were nascent. Look at the second domain now, which is human resources. As I said earlier, human resources, we looked at 3 broad areas. The existing policy for interoperability and digital health in general, and there was human resource capacity in the country in terms of skills and numbers, as well as capacity development. As you can see from this chart, all the countries that were assessed nearly scored just about the same in all the areas. Broadly speaking here, is that human resource capacity within the region for HIS and interoperability is one area that is not strong. The third domain, which is technology, you can see the 3 countries presented here. And without going to details, you can see Kenya and Rwanda here. There were elements that were identified to be much, that have moved further along in terms of area of technology, such as, for example, in Kenya, you can see communication network on which data can be used to, data can be exchanged, scoring at all the way at 4 points. HIS systems and national HIS structure architecture at 3, which is the point established. But again, a few other areas were identified that need to be strengthened. Rwanda, there were strong areas as well as areas that were identified that needed further growth. But the two countries, the data showed like they were close in terms of strength in many of the areas. Uganda identified communication network, working with the ICT division that was strong at point 3, but there was also areas identified for improvement. The last chart here on technology is the United Republic of Tanzania. You can see the data for yourself. Most of the points between nascent and emerging, point 1 and point 2, and there was consensus that much was being done to try to bring all these areas strong. Well, one point I need to note as I move to the next slide is that this assessment was not meant for comparing countries. The stakeholders as well as the data we collected in the country was meant to for the country to look inwardly and see which areas were strong and which areas that were needed further strengthening towards achieving interoperability within the country and also ability to share data across the countries. Now, I'll move on to summary results. Now looking at across the board as opposed to how I was looking at each of the countries, we identified certain barriers across the board that there are disparities in technical capacity for digital health and interoperability. So that was a disparity that was identified. And then also that at the time of the assessment, there was no common laws, policies, and regulations and standards, across the region that could, at the time, enhance cross-border data sharing. Of course, we've identified that there was weak human resource capacity in terms of skills and numbers, and they lacked coordination around a shared vision for interoperability within the countries that we did the assessment. In addition, there was varying understanding of the meaning of interoperability. That was a disconnect, that the understanding of what is interoperability of information system wasn't common knowledge or was not defined consistently across the countries. And there was, weak coordination that needed to be strengthened. And also an important point here is that there was a kind of a chasm between Ministry of Health and ICT, and this needed to work together to realize interoperability, because one is providing health services, the other one is providing the technological infrastructure to help realize HIS interoperability. But we also identified some opportunities that countries can collaborate and learn from each other, because there were best practices in different countries, so they could come together and identify where there are strengths and weaknesses and see how one country can learn from the other to strengthen their weak areas and sustain their strong points. We also identified many homegrown digital health information systems to learn from, homegrown, developed over a period of time. And they were critical for strengthening health information systems in those countries. However, there was also goodwill and momentum in the area of developing digital health. For example, digital reach was playing a significant role. Global partnership on sustainable development data was also chipping in with on important areas of HIS and interoperability, as well as across the board e-government initiatives in each of the countries. Then another opportunity is timing is right. Countries are generally in the nascent stage, so it is easier to build on a shared framework. We identified capacity needs, that there's deeper understanding by leadership on the value of interoperability and specific use cases that highlight its value. So I will share the link for the final report, which you can see, those identified areas that countries can learn from each other, and different use cases that can be used to support those learnings. Another capacity need is the need to strengthen local institutions to produce appropriate qualified people in the right numbers and skills to support digital health. Regional technical working groups on digital health or interoperability are important to keep on nurturing this field. And also an important area is to socialize adherence to principles for digital development and principles for donor alignment.
Kindly wrap up in 2 minutes.
Okay, thank you. Now, here are study limitations as you look at these results. The study was done mainly at the national levels of these countries and not below national. And, at the time, we did not include Burundi and South Sudan. The assessments were done at the national level, and therefore may lack a subnational sensitivity. The results may also reflect participants' biases on how they interpret HIS and interoperability. Sometimes the exercise was seen as a technology exercise, whereas it was meant to be a broad-based, health information systems and how those integrate and share data among them. So let me share what happened next in my last minute and a half. Once we were done with the assessment in those countries, we held a dissemination workshop in Nairobi with ISTECO and representatives from countries that participated in the assessment. And we came up with these 4 recommendations in that meeting in Nairobi. 1, the need to nurture human resource capacity development. Number 2, the need to establish national HIS architecture in each of the countries. And number 3, the need to enforce compliance with data exchange standards. And lastly, to undertake domestic financial mobilization to sustain these processes moving forward. I will skip the countries, or maybe I could quickly share. Whereas the 4 recommendations I've just spoken about was for the ISTECO, countries themselves found quite some work that they needed to do by themselves in terms of developing governance documents that to guide HIS interoperability. They needed to strengthen their governance structures, and there was need to bring in a public sector because of their many years of experience and best practice in use of technology, and also to use the results of the assessment to advocate for resources, with the donor or funding agencies. So thank you very much. If you go online and Google the report, you'll be able to find the report online, which has much more details than what I was able to cover in those few minutes. So thank you very much, Moses, and thank you everyone for listening to me.
Yeah, thank you very much, Mr. Wambugu. We are very grateful for that wonderful presentation, very insightful indeed, and very informative. We have navigated through 7 very highly informative presentations, and I believe the number of questions, this is the time when we have interactive session where we will have question and answer. We have about 7-8 questions in the chat room. Let me quickly summarize them. I will invite our presenters to quickly look at the discussions, click on the discuss button, and you should be in position to see the questions that have been posed. Probably you could respond to some of those questions within the chat room. Ladies and gentlemen, I will invite questions, but let me first highlight the questions we have in the chat room. One, there was a question on the data warehouse. Are we going to have one data warehouse, or are we going to have a number of warehouses? I think this one we can respond to that. There was a question on, this is to Julio. You talked about regional and national data centers. Where are these supposed to be, and who is in charge? How are they managed? The detailed questions are in the chat room. There also a quick question on where are we with implementing the digital technology target according to 2030 SDGs. Are we in the middle of the road? Are we on the side? Are we just starting? And of course, there are many other questions. I would like to open up this for the question and answer session, but probably we could quickly get some responses to the questions. There was a question on the multiplicity of the digital health strategies, initiatives, strategic plans. How do we ensure that the region benefits from this? Patrick, do you want to come on board and respond to this, or any other person who is available? Thank you.
I'm happy to. I think the benefit and value of the digital agenda is to provide a really robust piece of infrastructure that the region needs, that any of the countries can use individually, that the region can use for specific sectoral plans like digital reach. So the infrastructure that's created through the digital agenda becomes a good that is needed. And in fact, that type of good is already reflected in the Digital Reach Initiative plans. So there's already crossover in terms of the opportunity for digital reach to make use of this platform as it's developed. Also, I can just comment on the fact that when the Digital Reach Initiative plan was created, the consultations were done with each of the individual countries so that the Digital Reach Initiative is complementary to the country plans, not a duplication or an overlap with the country plans. So the Digital Reach Initiative tends to focus on programs and initiatives that are more cross-border in nature, like the cross-border surveillance program, to avoid exactly that problem.
Thank you very much for that submission. Indeed, we need to ensure that the initiatives and the agenda, there's that link. We must ensure that that linkage is there and it's critical. Maybe let's try to respond to the questions within the chat room. There was, how is the ES digital architecture and is from Esteco and the one at Health Research Commission, how are they linked? I think that one has been responded to. And I hope that we can further strengthen that linkage and the benefits go to our countries. There was a question, I wanted to pose a question to Sam, Mr. Sam Wambugu, with regards to this very important study you conducted, and actually the report is very informative. How far have we gone? Do we have an instrument that has been put in place to ensure that we can monitor progress in the countries? Is there a framework for monitoring and reporting how far the countries have moved based on the current baseline that is given by the study?
Yeah, thank you for that question. The framework that can be used for this is the Digital Health Index, which, as I said, is based on some 19 areas, and it is developed by WHO and stakeholders. When that instrument, when that yardstick of those 19 areas within digital health is applied consistently, it can help measure progress. And I think those studies and the data available online, I guess that will be the immediate yardstick that I can use for measuring progress over a period of time. However, I think also in-country assessments, in-country interventions that are currently ongoing, because there are still, many programs that we identified that were, going on at the time, and there are still, many that are going on, can help, produce data to map on the maturity model, the 5-point scale on each of the areas. Mapping data there, can show where we started and where, the country is at this point on that maturity continuum. I think is a very powerful tool for measuring progress. Over.
Thank you, Sam. I don't know whether there are some hands. I don't have the ability to see the hands. But Julio, you have a question. What is the plan for analysis? What's the plan for analysis and use of the big data? Yes, there's somebody who is coming in. Please communicate.
Thank you, moderator. Currently, there is no initiative that undertaking. However, it is important to start the dialogue between stakeholders, start engaging innovators as well as policymakers to make sure that we are trying some low-hanging fruits in that direction. And from there, we'll be ready to now have the readiness assessment, have the different plans, and also work closely and empower innovators to make sure they are trying some low-hanging fruit. Thank you.
Thank you very much, Julio, for that very precise response. Well, ladies and gentlemen, as I drive this to the very, very, very end, allow me to say, just raise a few points that I've picked from the 7 presentations and from the chat room. Of course, we have noted very well that the timing of this conference is pretty good, and we should make use of the current situation to improve on our health infrastructure, so that we're able to deliver services effectively and leave no one behind. The issue of having standards as we implement and embrace digital health, we need to also include the issue of standards. And clearly the study that was conducted by Estico clearly shows that we need to have our systems that are interoperable, but also taking into account the issues of standards as we design our systems. It's clear, it has come out clearly that interoperability of our systems is going to need us to invest more in issues on human resource, the human resource component. We need to invest in the issue of the technology, but more importantly, the leadership and governance, where we will be looking at the harmonized instruments, the tools, the guidelines that need to be in place. Also, from the very beginning and throughout the session, we have had issues around human resource and issues of ensuring that our providers are actually equipped with the right skills. I heard of the use of technology in offering services, and therefore we will need to have a multi-sectoral approach where we also look at our education sector coming on board and embracing the technological advancements. But more importantly, to look at the curricula at the different levels to ensure that these actually embrace and bring on board the use of technological advancement in delivery of services, of health services. But more important, on the other side, still when you look at the education sector, there was an opportunity that the current outbreak, actually, COVID outbreak, has allowed us to probably invest more in our infrastructure that we're using for delivering education, for training our learners in our different countries. We also heard that we will need to emphasize more of the homemade, emphasize more and embrace the homemade technological advancements. This copy and paste, what has worked elsewhere may not really work. We need to embrace homemade innovations. Of course, benchmarking on what has worked somewhere else, but bring it and contextualizing it and making sure that it is really applicable and can be useful in our region. We have also noted that the issue of partnerships are critical. especially as we look at investment in this, in the use of technology in improving access to access and delivery of health services. Multi-sectoral approach has been emphasized. The need to work, bring the different critical sectors, and I remember there was climate, I think education, agriculture. These are critical sectors, priority sectors that we need to consider when we're looking at digitalization and use of technology, because they are going to impact on the outcomes in the health sector or the use of the sector. Clearly, it has been demonstrated that we have invested in this into use of technology, but the investment is not adequate. And this is the time we need to use the current situation, which is the COVID pandemic. It has brought challenges, but it has also brought opportunities where countries are investing in the health sector, investing in the technological advancement to ensure that they continue to deliver. And we have seen how investment in technology has helped to keep our region afloat through the electronic cargo and tracking system, which has been very useful. I request that kindly you mute as I quickly summarize the issues. Of course, we have a number of barriers in our region, but it's my hope and belief that the barriers can be addressed very well as we move forward. It has been emphasized severally by different presenters that technology offers us a number of advantages in terms of healthcare delivery. We heard from the telemedicine, we heard about mHealth, and indeed we need to embrace technological advancement in offering health. So embracing digital technologies will not only involve us bringing the technologies, but there are other aspects we need to look at critically that came out is ensuring that we have the right environment, the policies, the infrastructure, the mindset, the attitude, and the ensuring that the systems are interlinked and interoperable. Ladies and gentlemen, there is a lot that has been said. I can just do that much in terms of summarizing. And of course, from the regional angle, it is important to embrace the regional approach. As we embrace digital technologies, the regional approach is important because we need to go beyond the border, we need to share information, we need to ensure that our systems that we're putting in place actually can be compatible and interoperable with those in the neighboring countries, maybe the departments that we cooperate with within the country. Ladies and gentlemen, allow me to thank the organizers for having given me this opportunity to be your moderator, and also for you having given me the opportunity, though you did ask many questions, but you've given me a good opportunity to be your moderator. Thank you very much, and thank you for being patient. We have gone overboard the time we allowed by about 24 minutes, but I think it is for the bigger good that we are here, and we use this opportunity in this session to learn more, continue interacting, and I hope that the outcomes and the experts will continue to respond to the questions even outside this plenary session. Thank you very much for participating, and that's all from me. I'm from the ES Secretariat Health Department, Dr. Michael Katende. Asanteni sana. Bye. Over from my side. Thank you very much.